also trying to tell me that the pain is all in my head. Psychological. Do you think I'm making this up? I'm in pain!
Last week we went through 2 of the top 5 challenges faced during consultations with people suffering from chronic pain. Today I'm going to go through 3 other common challenges faced during consultations and how to address these. This will enable you to have more productive and effective conversations, save valuable clinic time, and reduce the heart sink moments you may be experiencing when seeing a patient with chronic pain. Hey friends, welcome back to the channel. If you're new here, my name is Mahin and I'm a physiotherapist specialising in pain management based in the UK. On this channel, we explore ways to improve our interactions with those suffering from pain so that we can help them create healthier and happier lives. Today, I'm going to go through 3 of the top 5 challenges faced when working with people in chronic pain. So let's get into it. As I did last week, I'm going to start off by taking you through part of a consultation that you may be familiar with. Kevin was pacing the clinic room. I just told him that there was no one quick cure or fix for his back pain.
How am I supposed to get back to work with all this pain? Surely something can be done to take it away.
I explained that it's not always possible to have an immediate effect on pain, and it's important to look at management strategies so that he can return to the things that are important to him.
But my pain won't let me return. I need something that's going to give me some relief before I can consider going back to my activities.
Kevin was on 3 different medications, all aimed at reducing his pain. None of them were working, and neither had the ones he'd tried previously. Kevin had tried exercises, acupuncture, facet joint injections, and rest to help with his pain. He'd also seen 2 physiotherapists, a chiropractor, and an osteopath. All of these things did not provide any long-term benefit. Kevin also described his previous experience with exercises, and every time that he tried to do these exercises or increase his activity levels, it would just flare up his pain. Sound familiar? I'm not surprised. Every day I see patients who've gone through various treatment methods, all without providing any long-term benefit to their pain. Again, I want to make it absolutely clear that the single thing that has helped me the most in managing these challenges faced when speaking to people with chronic pain is being able to speak to people as people rather than patients. It's stepping back from that paternalistic 2 sides of the table approach to actually meeting patients where they are with honesty and transparency. Building the rapport and building trust is absolutely key. Let's now go into the next 3 top challenges faced when working with people with chronic pain. So when patients come to us, they quite rightly and understandably want a relief from their pain or for that pain to go away completely. And often what we're trying to propose to them is management strategies for their pain and moving forwards even in the presence of their pain. Now this can cause a bit of a mismatch in what the patient expects and what we expect from the treatment or the consultations that we're having. And this can cause some issues because if we aren't allowing our expectations to align, then actually we're not going for the same goal. And this just means that the conversations become more difficult. The patient probably loses a lot of confidence in us, and we probably lose a lot of confidence in our ability to help patients then in the future. So it's really important not to beat around the bush with this. And I think actually asking the patient what they really feel is likely to happen after, their time in our service or whatever it is really key here. So often I just ask them and I say that, okay, so you've been in pain for X amount of years, let's say, 10 years, as you've mentioned to me today. Do you feel like this pain will go away completely eventually, or do you feel like this is something that you may be living with for the rest of your life? And actually by asking this direct question, most of the time, 95% of the time, patients probably say, yeah, I actually don't think this pain will go away. I think this is something I will have to live with, but I just want some reduction of that pain. And that's fair enough. I think aiming for a reduction in pain is reasonable. I think we need to be upfront and honest about how much impact we can have on actually reducing and getting rid of pain. But I think we can definitely have an influence on reducing pain or making it more manageable at least. And sometimes even if patients really do believe that a resolution to their pain can be offered, I like to just be honest with them, and I like to say to them at the first consultation that, look, I need to be honest with you here, and I'll always try and be honest throughout our conversations, but there may be a possibility that your pain may never go away completely. And this has been a bit of a powerful moment that I've found personally, because it's probably the time when patients show most emotion. So it's probably the time where actually this has brought them to tears compared to other parts of the conversation. Although that can initially seem worrying or distressing for us, actually in the long term it's probably a good thing, because we may be the first person who's actually said that to the patient, that there is a possibility their pain may never go away. Because usually with pain we're looking to fix the pain or help the pain. Actually saying that we can't necessarily always get rid of pain can be quite powerful because it allows people to move forwards from that. It allows them to develop a certain level of acceptance and also then move forwards knowing that their pain is going to be there for the journey, but actually then now the next stage is helping them get back to the things that they enjoy. This is arguably the most important shift for people living with long-term pain, and it's really where the gold can be found for us as clinicians and also for patients as well. To get there, we can start by helping patients reflect on the various treatments that they've had before and the investigations that they've had, and the impact this has then had on their pain and their lives following that. This is with the intention to help people see that they may have been chasing a cure or a fix for the pain for so long that it's taken away some really valuable time, energy and resources. And it's at this point that it's appropriate to offer patients a different way of living with pain. And it's really important to ask permission to be able to do this, because this can lower any walls that may be between you and the patient. Don't forget that the person in front of you has likely seen lots of different professionals before and would likely have a lot of hesitations around how you can help them. So by asking permission to explore a new way is a really good way of just bringing down any barriers that you may have, and it just helps to just build the rapport with the patient. As I mentioned before, that is the most important thing with this. And living well in the presence of pain is what we call acceptance. And acceptance does not mean giving in or just putting up with the pain, despite the connotations of the word. Acceptance actually means a willingness to accept that the pain may be along for the journey, and rather than using all their energy and resources to fight against the pain, actually using them to engage with their valued activities once more or return to their important activities in the presence of pain. Using the pain cycle here can be really, really helpful. So here we've got the pain cycle, and I always go through this with patients because I think it's just a really common way of responding to pain, and I don't think I've had a patient who's looked at this and hasn't resonated with it. So we start off at the top. So I explain that with pain, there is a natural fear or concern that that pain is going to get worse, or we're going to do something to flare up the pain. And that then leads to us kind of avoiding certain activities that might be painful over time. And these are very common responses to pain. It's absolutely understandable that that fear or worry is there, and how that then leads to avoiding certain activities that may be painful. Over time then, that avoidance leads to a reduction in function, a reduction in strength around the activity. And when we're not able to do the activities that we enjoy, this leads to lowering of mood and also other psychological distress around that. The reduction in function and the lowering in mood all leads to more pain, and that cycle continues. It's really important that we first of all show that to patients, because I think that's a really good way of them seeing, their own experiences within that cycle, but then offering the different way of how we might be able to begin to reverse that cycle. So we can't always help immediately with the pain. If there was one thing that would cure or fix the pain quickly, I'm sure the patient in front of you would have found that through seeing all these different professionals and seeking all the treatment options that they have before. So we can't always have an immediate impact on pain. We can't always have an immediate impact on the fear or the worry either, because again, at the end of the day, they're humans, and that fear and worry is very, very normal. But where we come in is, how can we help them get back to the activities that they've been avoiding due to their pain, so that we can improve their function in relation to that activity, improve their strength, increase their activity levels, which is then going to have a positive impact on the mood as they're able to return to things that they enjoy again, and all of those things then lead to less pain, and then that cycle starts to reverse. For more on the pain cycle, check out my video on how to reverse the persistent pain cycle, and I'll leave a link to that in the description below. This then brings us on nicely to the fifth and final common challenge. As with Kevin, you may hear from your patient that they've had a bad experience in the past with increased pain following exercises or trying to increase their activity level. And this is likely to have reduced their confidence and willingness to try this approach again in the future. It's important to remind patients at this point that pain does not mean damage, and actually exercise and activity is beneficial in the long term for managing pain. It's really important to remind them of this, because when we are starting with exercises, or we are returning to an activity, if it hasn't been done for a while, it's very likely that we're going to get a slight increase in pain. So it's really important to set the patient's expectations around that, so that when it does happen, they're not put off from doing the exercises. They'll think, so-and-so who I spoke to, they did let me know about this, that there may be a little bit more pain. This is normal. I'll continue because I know I'm not doing any further damage. We can then talk about gradually reintroducing activities that they've been avoiding to increase their activity levels. As a physiotherapist, I use this as a starting point for all my patients, and I find out, first of all, what is important to them that they want to return to, and what have they been avoiding. And I use those two things as a starting point for my rehab plan. For example, if the patient's coming to me and saying that they previously really enjoyed taking their kids to the park, but they can't do that anymore because their walking is limited, then we start with walking. One of their values might be, being a good parent to their children and being able to do fun things with them as part of that. So it's really important that we help them get back to being able to do that. And if walking is the barrier, we start with walking. Now, I'd usually suggest that they start at their baseline, and a baseline is a level of activity that they can do when they come back feeling like they potentially could have done a little bit more, and they're not experiencing significant increases in pain after doing it. They might have slight increases in pain, but not significant, and that's what a baseline level of activity is. And we start at a level that they feel is very manageable, and then we can gradually increase from there. If they're struggling with carrying shopping bags, then we start with a light lifting exercise. It really is that easy, and the really important thing is to start simple, so starting with 1 or 2 exercises and gradually building up from there. We actually want to start off at a level that the patient feels is almost too easy, okay? Because it's much better to start off low and build up slowly than going in too hard, the patient experiencing a flare-up of their pain, and it then putting them off the exercises or increasing their activity levels again in the future. And this is often, I'm now speaking from a physiotherapy point of view, but this is often where we go wrong with helping people with chronic pain. As physiotherapists, we go in too hard and we don't regress the exercises quick enough. I actually think we shouldn't even need to regress, because we should be having conversations about what the patient's limitations are at the first appointment and starting well underneath that. I've had patients before where we want to increase their walking and it's 20 minutes to the park, and all I've asked them to do is to walk down to the bottom of their garden and back for the first week, every day for the first week, and they've come back and gone, yeah, that was easy, I could have done more. But we actually stick with that for 1 week. We build that habit of them doing it daily, and then we can increase it from there. It's much easier to go up when we're starting off low than it is to come down when we've started off way too high. And to be honest with you, the easiest part of my job as a physiotherapist is finding the right rehab plan for patients, because they will tell me what's important to them as long as I've asked the right questions and I've listened to that appropriately, and also what they're avoiding. And that's what the rehab plan's based on. What do they want to get back to, and what are they currently avoiding? What are the barriers there? The exercises just come from that. For more on exercising on pain, check out my video, and I'll leave a link in the description to that below. This goes into how physical capacity can reduce over time with avoidance and reduced activity, meaning that the activity is going to be more painful to go back to the more time that's been spent away from it. If you found this helpful and haven't watched part 1 of this video yet, then be sure to check that out next. This goes through the 2 most common challenges faced when working with people with chronic pain. Thanks for watching, take care, and I'll see you next week.